Hi, I'd like to go ahead and code the first couple of pathology cases with you, and hopefully this will help you feel a little more comfortable as you move forward in coding the pathology cases of the practicum. Go ahead and pull up your modules and log into that coding practicum. Pull up the pathology case number 1 so you can view the same screen that I'm viewing with you right here, and we'll get started on reading this case together. So you've got a female patient here with breast cancer, and now she's got a non-traumatic fracture of the femur. I want you to think to yourself, what is the patient being seen for? What is the purpose of this encounter? Well, even though it's a pathology note, the purpose of her encounter or the purpose for this pathology was because she has a non-traumatic fracture of the femur, and that's going to be our primary diagnosis code. So you want to go to the index of your ICD book, your ICD-10, and the guidelines tell us when an encounter is for a pathological fracture due to a neoplasm and the focus of treatment is on the fracture, you need to code from subcategory M84.5. That's right in the guidelines for neoplasm. But we can figure this out for ourselves when we know that, when we just think to ourselves, why is she being seen? She's being seen for pathological fracture, and we know that it's due to neoplastic disease. So we're going to go to that index in our book and look up fracture. You'll see the subterm pathological, and then you'll even see due to neoplastic disease. And we know it's of the femur, so we want to get as specific as possible in that index, and that'll take us directly to the code that we need to go to, M84.55. We want to verify this in the tabular. This is what it looks like when we go to the tabular. And then we see a little red box here with 7th written in it. That is signaling to us that we need to be sure to select a 7th character. If we try to stop here at M84.551 and we put that on a claim form, it will get denied. This is an unacceptable code with 6 characters. It's telling us you must have the 7th character. That's what this red box is. And the 7th characters are found at the top of that M84.5 section. So you look up at the top of your page in the ICD-10 book and you'll see this little note here. And A is the 7th character, which represents an initial encounter. And that's the code we're going to select. Something I want you to remember about A when you're selecting this from the box, or when you're coding anything that like this, like a fracture. A is also stands for active. So you want to think of A for active. If you are coding a fracture that's actively being treated, then you're always going to select A. As long as it's actively being treated, A is going to be the selection. Okay? Obviously, if it's healed or it's got some complications, there's some other characters here that you can use, but A is for active. Remember that. Okay? The patient is also found to have bone cancer, which is what caused the fracture, obviously, and then the primary is breast cancer. So when you're coding for the metastatic bone cancer, you're going to look up bone, or you're going to go to the neoplasm table first, and then you're going to look under bone. You're going to find the subterm limb, and then we know the femur's in the lower limb, and in the lower limb, it's the short bone in that lower limb. So there's the code malignant secondary C79.51, and you'll obviously want to go and verify that's correct by going to the tabular. And the guidelines tell us to always, when you're coding a neoplastic metastatic disease, or anything that's secondary, you always want to code the primary. So we know the primary is breast cancer, and we're going to go back to the neoplasm table and find breast and that code for breast, which is C50.9. It's an unspecified site, and it's female. Make sure, underline these codes in your book, or these differences in the codes in that M or in that C50.9 section. You're going to see malignant neoplasm of the breast, and there's male and female. Make sure you underline or highlight or somehow get those differences, male, female, to stand out so you don't accidentally select the wrong code. Okay, now we've got to find the CPT code. To locate the pathology code for this bone specimen, you want to turn to the CPT index to the main term pathology and laboratory, and then you're going to find the subterm surgical pathology. Also, gross and micro exam are the next subterm, and the reason we want to go to gross and micro exam is because we see that there's a gross description and a microscopic description. So we know this is gross and microscopic. Under the subterm gross and micro exam, you want to locate those levels that they show. You can see here that under gross and micro exam, there's level 2 through level 6, and I always just go to the first level unless you have memorized what each level contains in its description. Just automatically go to either level 1, which is just a gross exam, so we won't go there. We want to make sure that we go under the gross and micro exam, 88302 to 88309. So let's turn there in our CPT manuals. As you can see, before we turn there, I want to just point out the way that I've marked my index in the CPT manual. This is just to help me when I'm going to search for something. It stands out to me to see surgical pathology. This is highlighted under the pathology and laboratory main term. I've highlighted this and just kind of squared it off, and these terms are used a lot when you're working in pathology, so that just helps me as you work in your CPT manual. Now, once we've looked at the tabular and have read through all of those levels, we find that in level 88307, you will see the term bone fragments, pathological fracture right here. And this is going to be, this indicates to us that this 88307 is the code that we want to use for this case. So we'll use 88307, and let's not forget the modifier. With pathology, your most common modifiers are TC and 26, TC being for the technical component, 26 being professional. So what modifier do you think we're going to use for this case? Remember, we're coding this as if we worked for the pathologist, right? Or as if you worked for the hospital, okay? So as if you worked for the hospital, what code do you, what modifier would be appropriate for this case? Well, if you said TC, then you're correct. The technical component is the modifier we would make sure that we add on to the back of this CPT code to indicate that it's for the technical component. All right, well, great job. We have just coded the first case in pathology in the practicum. Good job.